We'll get you to put your doctor hat on in a minute, but let's put your patient hat on first, because you've taken statins yourself, but you stopped. Why?
Yes, I was started on statins because I have a very high cholesterol of 8 and I have a family history of strokes. So I started on simvastatin and I had side effects, memory problems, I had muscle aches and joint pains, so it was intolerable. So I switched to atorvastatin, same thing, really bad headaches and joint pains. And so I switched yet again to another class of statins.
So the thing that they're talking about, this nocebo effect, where you're taking statins, you know there's a potential side effect. What do you think? Because you felt these aches and pains yourself.
Yes, exactly. So patients aren't imagining things. These side effects are real. In fact, in 2014, the US Food and Drug Administration recognized the side effects of statins. So they did say that memory loss, confusion, and now, of course, diabetes for some.
But how do you and others weigh that up against the benefits, against things like high cholesterol, and especially if you've had a stroke already or had a heart attack?
Yes. I think GPs would advise patients to take statins if you've had a heart attack or mini stroke or stroke, because of the risk of another one, and it could be fatal. Now, there are two classes of statins. So there's the type, the simvastatin or atorvastatin, which is lipophilic, which goes into the brain and causes these side effects. However, there are more expensive ones in a different class that are hydrophilic that don't give you muscle aches and pains and less likely to give you memory problems, and things like rosuvastatin. But rosuvastatin would cost the NHS £18 a month, atorvastatin £1 to £2 a month.
So there's a cost implication here as well. What do you make of the study itself? Because it's quite a large sample there, but it's funded
by the drug company Pfizer, who actually manufacture and make this drug, atorvastatin, so there's a big conflict of interest. I'd like to see an independent study. The other problem with this study is they put people on a 10 milligram dose of atorvastatin. Now, that's not even the recommended starting dose, according to NICE. It has to be 20 milligrams. So they're not really going to get side effects on 10 milligrams.
But even so, patients and their doctors need to weigh up the pros and cons of these side effects versus the benefits that they could have. Good to see you, and thanks very much indeed for coming in. Still to come.